role of protein content of complementary foods.
Hi, good morning. This is Dr. Eva Akwadikere. I'm a pediatrician at Benin Medical Care Hospital, Benin City, Nigeria. And I'll be talking about the role of protein in complementary feeding. Let me title this Laying the Foundation for Good Health Outcome. Complementary feeding are introduced at the 6th month of life because at this point, breast milk or formula alone is no longer able to provide all the nutrients the baby needs for optimal growth. At this time, the baby is ready developmentally for these feeds. However, of note is that these feeds must contain the right proportion of all the nutrients to ensure a balanced diet. Protein is one of the key nutrients and it's called a macronutrient because it's needed in a measurable amount. This amount of protein should be at least 100 grams per kilocal of energy, approximating that which is in breast milk. There have been studies that show that breastfed infants are less likely to develop obesity when compared to infants fed with formula high in protein. Now, this is because when protein is had in excess in males, after digestion, the amino acids needed for metabolism are used, obviously, but that which is left remain as excess amino acid in circulation. This leads to the release of insulin, which is a hormone, as well as a growth factor called insulin-like growth factor. This pair lead to the differentiation of fat cells, which are called adipocytes. Once these are developed, there is a high risk of that person going on to become obese, because once this happens during this complementary feeding time, it's like a programming. This child now has a tendency to store fat whenever any meal is in excess. Obesity on its own, it's usually a risk for other chronic diseases because it tends to be a part of a syndrome called metabolic syndrome, which has other diseases like coronary heart disease, type 2 diabetes, even hypertension. So it becomes very critical that meals we add for a child's feeding during complementary feeding are very important, and the breast milk, the protein component should be at about 100 grams per kilocal of energy to ensure optimal growth and to prevent development of severe risk for coronary heart disease and other chronic disorders. I thank you very much for listening.